presentation on learning disabilities. What is a learning disability? It's a condition that causes significant learning problems, which are most often related to reading and writing. A disability of unexpected underachievement that is typically resistant to treatment. Now, the characteristics of learning disabilities, they start at the academic level, which are resistance to treatment and difficult to teach, which then transfers into the social, which means they are socially unacceptable, and they misinterpret cues, which means they have problems not only forming but also keeping peer relationships. And then behavioral styles, which are hyperactive and poorly coordinated. The challenges that people face with learning disabilities are achieving reading fluency, which means them being able to read quickly and correctly. Not only reading quickly and correctly, but also comprehending what they read as well. Now these have an effect on a student's progress in academics, because failure to achieve those tasks do result in an effect on their confidence level as well, which not only affects the academics, but also their lives outside of the academic world. Now the characteristics, which are holding negative attributions, which means self-explanations about the reasons for one's success or failures. Being non-strategic, which means the sequencing or the order in which things do occur. They also have problems in generalizing or transferring learning, which means them learning of one skill to similar skills. There's always a complication. Like, for instance, if it's addition, regrouping with the 0 and the tens place, they can do that, but then they might have complications doing that same simple addition with no regrouping with the 0 and the ones place. They might not be able to see that there's a connection and that it's similar. And also processing information inefficiently or incorrectly. So they could hear the information, but the way they comprehend it would be incorrect to the information that they got. And then poor social skills, like I just previously mentioned. They have problems not only making but also maintaining peer relationships. Causes. Now, there's little known by the causes of learning disabilities. Now, some research studies do say that the cause of a disability is based on neurological impairment, which means it's something in the brain. There's also studies that say that it's the genetic, but it's hard to prove. And genetics means something that the child has got from the father or the mother. It's something embedded in them. And then low socioeconomic status, which would make it hard for them to have access to the health care that they need. And then them also living in dangerous environments. Now, prevention, like I did mention earlier, since there's actually little known about the cause of learning disabilities, there's even less known for a possible preventative procedure. Now, of course, always eliminating the toxins in an environment. And then I also, like I've seen other researchers say, early detection is the best preventative measures that you could take. Now, overcoming those challenges. Good teaching, which means having teachers that have the patience to teach the foundations to those students. And then early identification, which is just another term for early detection. Now, if the child is not talking by the age 3, then that's grounds to start looking into different things so that you can see if there's something going on in the child. Low birth weight, as well as children being premature. And then also coming from a poverty background also has an effect. Now, pre-referral response to intervention. Discrepancies, formulas. They calculate the gap between a student's achievement and his or her potential. Now, used to identify students with learning disabilities. Now, students in grades kindergarten through 4th are screened universally, and they're tested in the fall, which is once a year. Now, the student that exhibits skills that may put them in potential risk for reading failure are identified for the intervention group. Now, validate procedures are implemented, and students' progress is then monitored closely after the intervention. Lastly, students who do not learn after receiving these intense levels of instructions are then either identified as having a learning disability or sent for further assessments by a multidisciplinary team, but it depends on the rules that are identified by the district, of course. Now, advantages of RTI. There's no delays in receiving intervention. So if the child does show signs of a learning disability, then they are able to have an intervention immediately and start the child with the resources and things that they might need to live a successful life. Reduce inappropriate referrals, which means that there will be a decrease in students or children being identified or being diagnosed wrong. And then poor teaching, which should never be an excuse. And the assessment, which leads to intervention. Now, evaluation, monitoring the progress. Now, teachers should create or select an appropriate test and then graph the scores on a scale to see where that student may lie among other peers, and then set goals, which are just benchmarks to see where the student is falling, to see if they're progressing. Now, the core skills in reading. These are the skills that develop during the preschool years, which are important for the future success. The phonological awareness, and that's just identifying or separating sounds in words. The letter fluency, which are just the speed at which a child can identify letters in the alphabet upon seeing them. And the phonics, which are the ability to identify the sounds that represent each letter or each groups of letters. Now, instructional accommodations, which were the use of computers, the translation of text, the type phase, and teachers adjusting language to student comprehension, which just means the teacher modifying the words they use in order to explain things to the student so that they might understand what's going on. And then the validated practices, which are peer tutoring, which is just students teaching each other, learning strategies, advanced organizers, and mnemonics. And that's just merely aids that can help people remember things. I kind of like to remember that as just a muscle memory for the brain. And the RAP, that stands for read the paragraph, ask yourself the main ideas and details in the paragraph, and to put the main ideas and details in your own words. And the technology that students can benefit from are, the technology that benefits students are helping them augment an individual's strengths, compensate for the effects of their disabilities,